good afternoon, and thank you so much for joining us for the UWS Chiropractic Workshop Week. We're very excited to have you here. My name is Natasha French, and I'm the Assistant Director of Admissions and the International Student Advisor here at the University of Western States. Our event this afternoon will include a presentation about the clinical portion of the chiropractic program by Dr. Lindsay Pelly, and a presentation about diagnostic imaging at UWS by Dr. Melinda Novak. Afterwards, we'll have a Q&A with both presenters to make sure that all of your questions are answered. The entire event will be recorded, and we'll share the recording with everyone who RSVP'd. So if you need to pop out for a minute and come back in, don't worry. We'll have a recording available for you later. We hope you enjoy the event, and I'm excited to introduce our first speaker, Dr. Lindsay Pelly. So Dr. Pelly's experience with chiropractic care spans back to her athletic adolescence. After seeking chiropractic treatment for a soccer-related injury, Dr. Pelly developed an understanding and appreciation for the broad array of ways in which chiropractic care can promote well-being. Dr. Pelly understands well-being as living well, and her holistic approach places emphasis on equilibrium of both mind and body. She upholds this view by coordinating care unique to each individual, which is achieved through the integration of treatment methods such as diversified manual adjustment of both the spine and extremities, activator and drop table, myofascial manipulation, supplementation, kinesiotaping, instrument-assisted soft tissue manipulation, and both preventative and recovery-based exercise therapy. Dr. Pelly's specialty areas encompass working with a hypermobile population, such as yogis and dancers, providing treatment for temporomandibular disorders, conducting functional movement assessments to enhance performance, and focusing on the fundamentals of health, including diet and nutrition, diaphragmatic breathing techniques, and mindfulness. When not providing care to patients, Dr. Pelly enjoys spending time with her family, exploring and connecting with nature. So please help me in welcoming Dr. Lindsay Pelly.
Thank you very much, Natasha, for the introduction. So I'm going to be talking today about the clinical experience. So I'm going to share my screen. All right. So we were talking about the clinical experience today at UWS. So the campus health center we refer to as the Connected Whole Health. The UWS motto is always for the good of the patient. So we do like to obviously carry that motto across into UWS's Connected Whole Health. So we are always doing a patient-focused, evidence-guided approach. We do like, oh, sorry, I keep clicking through there. We do like to do obviously a multidisciplinary approach. For things that we do not have in-house, we do always refer out as needed. I know we're hoping to possibly get more multidisciplinary approaches actually in-house in campus, but for right now, if we do need to refer out, we do that. The Doctor of Chiropractic degree curriculum at UWS is focused on this core understanding and enduring the commitment as we prepare the graduates to provide conservative, whole person integrated care. The clinic experience begins as early as Q1. This is fantastic for you to familiarize the clinic as a patient so you can see the processes beforehand. Not only do yourself get chiropractic care, but so does your family and your significant others. So when you come into the clinic, you'll get a full workup. It's very thorough. We obviously offer chiropractic services, but we have many other services. Dr. Novak is going to be talking about the radiology services next. The lab work, I believe, is on the back burner for right now due to COVID, but that is something we've always had, and we hope to get back very soon. We have custom foot levelers, so we have the big scanner. All students get 2 free pairs every 2 years. So in your time here at UWS, you'll get about 4 free pairs of the foot levelers orthotics, and you can offer that to friends, family, and all of your patients. We, of course, look at nutritional supplementation for both support and rehab. So we do a lot of nutritional support, whether it's injury-based or just general looking for nutritional guidance. Of course, being a part of the clinic at a lower quarter will allow you to familiarize yourself with the clinic, see how it runs, and it does allow you to create a relationship with your student intern and with your clinician. And so it does allow for some mentorship. So we do encourage you to get in the clinic as early as possible. Your pre-clinic coursework, so prior to coming into the clinic, which occurs Q8, which I will touch on, there is coursework that will help prepare you for coming into the clinic. So we do encourage shadowing opportunities at any clinic in the Portland metro area, at the local offices, but also anywhere near home. I know some more of the earlier courses are doing more distance learning. So if you're at home in Canada, doing as many shadowing opportunities as possible. There's numerous courses that discusses the history taking exams, diagnosis, differential diagnosis, and treatment. The level of courses throughout Q1 through 8 is just has a lot of repetition and helps prepare you properly to enter into the clinic Q8. We do have documentation courses, and then prior to coming into clinic, there is a course specific to our EHR system, which is Epic, that we utilize in the clinic. There's also coding and billing courses that will help guide the coding and billing that will occur specifically in our clinic, which is Oregon specific since we are practicing in Oregon. There are also the clinical phase series that focuses on performance on simulated patients. This allows you to get clinic experience on standardized patients and practice the skills that you are learning and be able to practice them in real situations that is not direct patient care yet. So clinical internship 1 starts in Q8. There are 6 clinicians, 3 on A shift and 3 on B shift. I myself are on A shift. The A shift has 3 morning sessions and 2 evening sessions, and then the B shift is just opposite of that. We are open to the public. We take almost all major medical insurances. We most certainly have a wide variety of patients. And then again, we have our imaging center on site, which Dr. Novak will talk more about. So clinical experiences, very patient focused. To go back to our motto, we're always doing what's best for the patient. So although this is a learning facility, the patient is always what comes and who comes first at the clinic. Evidence-guided approaches. As evidence is continuing to be more and more important to have really good solid evidence, we always try to incorporate that into the clinic and are always trying to do better when new evidence comes out and stay up to date on that. So the types of treatments that we do in the clinic, you would imagine we do adjusting, but it's a variety of adjusting. We do a lot of manual adjustments, but we do have gentler techniques like the activator and drop table. A lot of soft tissue work, a lot of instrument assisted soft tissue work, for instance, the cupping, the Grasson tools, which everybody's most familiar with. We have class 4 laser and several cold lasers and also several class 3 lasers. The class 4 laser is a really phenomenal piece of equipment. It's been really fun being able to work with that piece of equipment and see what it can do. We have numerous flexion distraction tables, and we have all the fancy physical therapy modalities, electrotherapy like interferential current, Russian current, ultrasound. We have those big towers that offer the ability to do ultrasound, electrotherapy combos where some of the electrotherapy comes through the ultrasound head. So we have a variety of the PT modalities, and then we of course encourage a lot of active care, rehabilitation, both for preventative measures and also for rehabilitation. And then we do give diet counseling and nutritional recommendations. Clinical internship offsite opportunities. So this is something newer, the CBI program, clinical-based internships or community-based internships. And so this is allowing for full rotations at our community clinics, and this happens as early as Q10. This means you will be immersed into a community-based clinic under a different clinician or doc, and they will help guide you through what they like to do in their office. So it also offers just a more diverse experience. We also, in addition to our CBI locations, we do have our community-based rotations, which is Cascadia Behavior Health, Fora Treatment Center, and then Volunteers of America. After as further on in your training is preceptorship, which is Q12. So in here, the second bullet point is the VA clerkship, which is different than the CBI program and also different than preceptorship. So preceptorship occurs quarter 12. That's when you go and you are on, it's like a medical residency. A lot of those preceptorships transfer into actual jobs. The VA clerkship is something that occurs Q11 and Q12. And so we always hope to have somebody there for about the 2 rotations. Oh, sorry, I didn't mean to open that up. So the 2 rotations for Q11 and Q12, hoping that that will also turn into a residency and a job position. So community-based internships are mostly here. They are all here in the States. The preceptorship is where you can start utilizing them in Canada. The VA, we have 10 affiliations with 2 more in the workings all across the United States. All right. Here is our reception front desk area. Here's an example of one of the treatment rooms. It looks like this one's a flexion distraction table, but we have numerous different tables. The Rehab and Fitness Center, this is specifically the fitness center for the students to utilize. And then there's a separate rehabilitation room to be able to take patients into. Our laboratory for blood draws, urine analysis, and where most of our equipment lives. We have emergency oxygen that does live in this facility. And then any questions, which I did see one up top here.
Yeah, and actually we're gonna hold off on questions until the end, but you are welcome to take down Dr. Pelly's email address and reach out to her as well. So next, we'll stop sharing this screen and then I'll introduce our next speaker, Dr. Melinda Novak. So Dr. Novak is a transplant from the Midwest, Chicago and Michigan, who needed to escape the snow. She followed the Oregon Trail, but not really, to Portland, Oregon, where she completed the chiropractic program. Following the completion of the DC program, Dr. Novak completed a diagnostic imaging residency at UWS and is a diplomate of the American Chiropractic Board of Radiology. Dr. Novak teaches a variety of the radiology courses at UWS, so if you end up enrolling, you will definitely have her as an instructor at some point. During her radiology residency, Dr. Novak completed a Master of Science degree in diagnostic imaging with her thesis research on the topic of diagnostic musculoskeletal ultrasound. Dr. Novak has achieved advanced certification in diagnostic musculoskeletal ultrasound and is one of only a few providers in the Portland area to offer these services. When not teaching or interpreting x-rays and ultrasounds, she loves to be in the kitchen whipping up a batch of bagels or pretzels, out on the water, kayaking, sailing, paddleboarding, or spending time with her wife and golden retriever puppy, Roxy. So please help me in welcoming Dr. Melinda Novak.
I teach on Zoom a lot and it's always funny. I mean, every day you forget, oh yeah, I have to unmute. It happens every day. So welcome, I'm glad that you're here. I love any opportunity to talk about x-rays and imaging in general. It's definitely a passion for me. And so even in my free time, it's often something that you'll find me, looking up and researching is more information about radiology. And Dr. Pelly mentioned that I was going to speak a little bit about the clinical radiology services, and I actually don't really provide any services in the clinic at this time. So really what I wanted to talk more about is just overall, what kind of stuff do you learn as a chiropractic student as far as radiology and diagnostic imaging goes? And because I'll be perfectly honest with you, when I was in your shoes as a prospective chiropractic student, I didn't even know that chiropractors took x-rays. There's my dirty little secret. I didn't know it was really something that was a part of our scope of practice, and I didn't know how that it could be utilized in our offices. And so it's sort of surprising how I ended up where I am, I guess. But yeah, so in first quarter of the program, within days of stepping onto campus, one of the first classes you take is in radiology. It goes side by side with learning just the anatomy of the human body, which there's a lot of it, come to find out. So right beside learning the normal anatomy from a textbook and from the cadaver experience, you also get to learn it on an X-ray, which is a lot different than learning it from a textbook. So I teach a series of classes in the first year of the program, just really focused on normal anatomy. And it sounds like a lot, why do you need like almost an entire year to talk about normal anatomy? And it's like, okay, so one of my first examples, I like sharing cases and looking at X-rays, not so much looking at words. That's my preference. But so these first couple examples, this is of the cervical spine. This is your neck region. And I look at a lot of X-rays in this area because, neck pain is a really common complaint. And these two examples, I picked these two because I thought that they looked really essentially normal. Okay, so normal anatomy, right? It's normal. There's really nothing going on. There's no fractures, there's no dislocation, no infections, no tumors, nothing, nothing crazy. But one of the things that we have to talk about when discussing normal anatomy is that even two things that are quote unquote normal, they're still going to look different. And I find that really kind of exciting, is that, two things that are essentially normal can still be, they still look different from each other. So for as many people as there are on this call, and there's not that many, but for every student on our campus, everyone's X-rays will look different. If we were to look at all of them. And so, these are two views of the neck. Like I mentioned, they're a side view. So like a profile view. If you were to put your face on a coin, this is kind of how it would look, or this is how I'd want my coin to look, I guess, with an X-ray on it. But so even not knowing anything about anatomy, specifically, on an X-ray, if you look close, you can, hopefully maybe start seeing some differences. This person has a tongue piercing, so okay, that's different. Not everybody has that. There's some parts of the osseous part of the spine here that, they have a slightly different shape. And I just find this stuff so fascinating, that even two things that are essentially normal, they look a little bit different from each other. And, you start looking at some of these other structures here, and it's like, okay, they're very, very similar, but they are different. And I just love that, because, but that's also what makes determining whether an X-ray is normal or not kind of difficult, because there's an infinite amount of normal examples of anatomy. So it does take a lot of time. It takes a lot of practice. It takes a lot of skill and mentoring and growth to be comfortable looking at even a normal X-ray. But then, all of a sudden, like a light bulb goes off, and you do have this understanding of normal. And then you start thinking like, okay, I know everything. But then, we put you through a whole series of classes of abnormal X-ray diagnosis. And that's really where the fun starts, because you get to learn just what a wide array of pathologies show up on an X-ray and may present as neck pain in our chiropractic office. And so you kind of have to be prepared for all circumstances and all pathologies, even if it's not something that's in your scope of practice to treat. We have to be aware of what these things look like, so that we can recognize them on our imaging. So these two patients, these are different patients, same view, right? Same view of the cervical spine. We're looking at it from the side. These are two different people who have the same abnormality. These are not normal images. And actually both of them have a number of abnormal findings, but there's some main ones I wanted to focus on. Does anybody know, who's on the call, does anybody know how many cervical vertebrae you're supposed to have? What's the normal amount? You can put it in the chat if you want. Does anyone know how many cervical vertebrae there are? And it's okay if you don't know that. We will definitely teach you that, probably week 1 of the program.
Yeah, you can add it into the Q&A if you want.
Yeah. I
Number
see
7.
Someone says 7. Okay, good. Yeah, that's correct. Okay, so we'll go with that. So someone answered and it was correct. So I'm already, part of my job is already done. Yeah, there's 7 cervical vertebra, and a couple of them are a little bit unusual. Up at the top, we have C1, which it's kind of a ring shape, and we'll get into why it looks like this on an X-ray later on. But this is C1, and then C2 is right in here, kind of overlapping, and this is C3, and this is C4, 5, 6. Why does that one look so weird, you know? And the same thing over here. It's like, here's C1, here's C2, here's C3, C4. So these people both have a pathology or an abnormality that we would describe as a block vertebra, where in fetal development, when this person was not yet born, when both of these people were not yet born, their spinal segments, you know, these 2 segments right here, they were supposed to separate, and they never did. And so we call these block vertebra, and they're actually fairly common anatomical variations. And this is another one of my most favorite topics to talk about, is that, you know, all kinds of things go sort of wrong in development, and sometimes it causes problems and pain and dysfunction, and sometimes it doesn't. Sometimes we find these things really incidentally, and they don't cause any problems. So these 2, you know, both have the same sort of abnormality, but at different levels, and it's actually a pretty common finding in the chiropractic setting, because these don't usually cause a lot of pain, but they can cause abnormal motion of the spine. You know, maybe when you're bending down, bending back, looking side to side, maybe you notice that there's a little bit of limitation in movement, and it could be attributed to these block vertebra. So X-rays are a really great tool to have at our you know, in our clinic space. And so these are 2 examples of block vertebra. And so moving on to this next person, this is the same patient now, but 2 different views, one from the side, which maybe you recognize by now, and then one from the front, just like you know, we're kind of looking at each other. So 2 different views, and this is always the best way to look at X-rays, is with 2 different views. And hey, look, this person has a block vertebra too. So now we're feeling like a little bit more confident. Like, you've seen, this is the 3rd one now. Maybe you'll recognize it the next time you see it, and you'll know what that is. So one of the lessons that that I learned from one of my mentors, who actually does work in the clinic in radiology, and that I like to teach to students, is that, you know, these are real people. All the images that I show in my class and in any kind of presentation, these are all real people, and people are entitled to also have more than one thing going on with them. So this person does have a block vertebra, but there's actually something else going on that's much more significant. And so it's an important sort of thing to keep in mind when looking at X-rays and working in radiology, is that even though, you know, yeah, I feel like a winner, I found that block vertebra, we can just quit, it's happy hour time, you know, you have to keep looking, you know, because there's other things that could be going on. It's kind of like playing Where's Waldo, only you don't even know if there is a Waldo, and you don't know if there's more than one Waldo. You never know how many there are. So it's like that, but it's harder. So when we look at this front view, I provided this frontal view for a reason. I'm going to point out another structure that you probably, I mean, I don't know why you would know this unless you have a background in radiology, but there's a dark tube that we see right here, and that's the trachea. The trachea is filled with air, right? That's what conducts air into and out of our lungs. And it should be right in the middle. It should be right in the middle. But this one seems to be curved and kind of pushed off to the side. And why is that? Because I'll tell you one thing, that's never going to be normal. It's never normal. It's always going to be a significant finding if you see it. So why is the trachea pushed off to the side? I don't know. Something's either pushing it off to the side or pulling it off to the side. And that doesn't sound like a good thing, does it? And so actually, you know, these are actually really crappy X-rays, I'll admit that. But we look at this is actually the very uppermost part of the lungs that we see on these cervical spine X-rays. We do see part of the lungs here. And what stood out to me on this view was this person actually has a mass. there's a mass in the lung, in the upper part of the lung, and you can see actually a little bit of some abnormal densities over here. And of course, I wouldn't expect you to know any of these things yet. I'll teach you, don't worry. But this person has a mass, and it was growing from their thyroid gland, which is at the base of the neck, the anterior neck. And they developed what's called a thyroid goiter. And a goiter, I don't know if you're familiar with this, you could Google it later. They're not super common in the United States or North America, I should say. But I've seen this a few times, and sometimes these goiters get so big that they actually start growing into the chest. And when they do that, they start pushing nerves, blood vessels, the trachea. So yay, we found a blocked vertebra. That's exciting. But what do you think is more clinically relevant? What needs more attention, more focus, maybe more aggressive treatment? The blocked vertebra that they had since before they were born, or maybe this thyroid goiter, this mass that's growing and displacing the trachea, So it's always important to keep looking and make sure you're looking at the entire image. And remember, this is a patient. And I like to look at imaging as if I'm looking at a family member's x-rays. I want to make sure I'm being as thorough as possible. So I work in I don't know, my lighting is a little weird. Maybe it looks that way. I look a little orange right now, actually. But I basically live and work in a cave, because you have to look at x-rays in a really dark environment so that your brain is not too distracted by extraneous light coming in. Anyway, my last case that I want to share, and I hope I'm not over my time yet. This last case that I want to share is another important topic in the world of chiropractic, and you all will be very well trained by the time you graduate. We have, a number of radiology courses. I described, a whole series of normal anatomy. We have a whole series of pathology on radiographs. You get to learn how to take x-rays, position the patient, and then you may get to take some in our clinic setting, which is exciting. So you're going to have a lot of experience in radiology. And it's important to remember that when you're out in the world and working with other healthcare providers, you have to own your knowledge and experience, and you can be confident in what you've learned. This was a recent patient for me. The patient on the right, I should say, this one on the left, I provided just for comparison, because, who knows, do you all know shoulder anatomy yet? I mean, maybe some of you do, but just for comparison. So as a chiropractor and a chiropractic radiologist specifically, I look at a lot of x-rays for other chiropractors. They want my second opinion. They want my expertise from all that additional training that I did to become a chiropractic radiologist. So I often get x-rays, but I don't get history. I don't get this background information. I don't know if the patient fell. I don't know if they were in a car accident. I don't know if they've just had, pain for years and years and years, and it's not getting any better. So I go in looking at all of my x-rays very objectively and essentially blind. Well, not eyeball blind. Obviously, you need your eyeballs to look at the x-rays, but I go in without really a lot of patient information. And so that helps me to kind of keep my bias out of it. Because if I know the patient had a fall, then I'm going to go in looking for things like fractures, dislocations, soft tissue injuries, that kind of stuff. And so I didn't get this information when I saw these images, but again, I have training, I have knowledge, I have experience. And so I know what normal looks like too. And so I'm going to draw a couple things for you. This is the proximal humerus. This is your big arm bone, the big long arm bone. So that's the humerus. This is the glenoid, which is, oops, I just erased it. This is the glenoid, which is part of the scapula. That's that kind of wing, that flat kind of wing-like bone on your back over your rib cage. And those two things should articulate. They form a joint. They should be touching each other, right? They should be. And what we have here is that they're not. And you can look over here at the normal comparison, how they kind of line up really, they look like they overlap quite a bit, and that's normal. They're supposed to. So what's going on in this case? You know, what's going on? So I'll give you the background, because I didn't get this background until a couple weeks later, surprisingly. But this was a 68-year-old patient who had shoulder pain, hand pain, wrist pain after falling. And he went to the emergency department where they took these x-rays, and the patient was told that he had no broken bones. And they're not wrong. It's not a fracture, right? There are no broken bones. So they're technically not wrong. But does anybody know what's going on here? Has anyone had this happen to them? It's not an uncommon thing for some of our students to have had happen. Does anyone take a guess as to what this patient is experiencing? And if you don't, that's okay. I'll put Dr. Pelly on the spot too.
Yeah, if you want to
Don't
guess,
think I won't do it.
feel free to post it in the Q&A if you have a guess.
And yeah, so if I don't see anything in the next like 5 seconds, I'll just spill the beans. But this is a shoulder dislocation. I mean, this is really a textbook example of a shoulder dislocation, an anterior shoulder dislocation, which is not uncommon when you fall out onto your hand. You know, I don't know if that's ever happened to anybody where you fell and you caught yourself with your hand or part of your arm. This is not an uncommon injury, and it absolutely would be at the forefront of my thinking when taking an x-ray, you know, on someone with this history. So unfortunately, sometimes, you know, part of our job as a healthcare provider is to also, you know, because we want the best care possible for the patient, we're listening to the patient. Sometimes we have to disagree with other medical providers. It doesn't happen often, but I don't know if you've been to an ER recently. It's just kind of, it's nuts. Everyone's overworked and you know, just stressed, and we miss things. We're human beings, we miss things. And so that's where I feel like I really am of service to chiropractors and to our patients, is that I get to slow down and take a look at these images, add a second layer of eyes and evaluation, and say, listen, yeah, there's no broken bones, but there's definitely a shoulder dislocation, and that's something that needs to be managed, right? So sometimes we have to disagree with other medical providers, and we can do so with confidence because of our training, our experience, and you know, listening to the patient about what's going on, and really just trying to provide the best care that we can. Like I said, I like to look at these images as if, you know, each one of these is my niece or my wife or my cousin or whatever, grandma. I really try and do the best I can. And I think all of my colleagues, all of my chiropractic colleagues do the same thing. So anyway, I can talk on and on and on. These are the last of the cases I have to share. I, of course, could keep talking forever if I was allowed to, but they said I had a time limit, so no more cases. You'll just have to enroll in the program, and then you might have too many.
Thank you so much, Dr. Novak. That was incredibly helpful. And I loved learning the case studies, and I'm sure everyone else did too. So I'm sure that brought up a lot of questions for our attendees, and feel free to go ahead and post more questions in the Q&A box, and you can either do it anonymously or with your name. But I'm going to go ahead and start reading some of those first questions and pose them to Dr. Pelly and Dr. Novak so we can get some questions answered. So the first question we have is, can internships be in other countries as well, such as in Canada?
So the CBI program and the VA are specific to the US. So the CBI programs are specific that they are the community-based clinics, so they can only be a certain distance from the school. So CBI will be all clinics in the Portland metro area. The VAs are obviously US based, but they are across the United States, Vegas, Cincinnati, in Connecticut also. And then the preceptorship, which you would do 12th quarter, is open to Canada clinics.
Yeah. And a lot of our students do that final term in Canada and then end up staying at that clinic and joining it eventually. So I do see that being a great opportunity to test out a clinic before you sign a contract. Our next question, how deep does UWS go into chiropractic philosophy comparative to universities like Life or Sherman?
So I can speak a little bit to that. I don't teach in any of the philosophy classes, but We take the same board exams as schools like Sherman do. We all take the same exams. And so that being said, we have to have the same knowledge and background information. And so we do have history and philosophy classes at UWS. I guess I don't know specifically how many classes or how many credits Sherman goes into for that sort of thing, but it is something that we absolutely teach our students. And we, I don't know if anyone went to Dr. Gary Schultz's webinar. He teaches, I think, all of those classes for us. He is a wealth of knowledge. I mean, really like an encyclopedia of chiropractic history. He knows more about different techniques and different really important people and philosophies in the chiropractic world. So I mean, short answer, you definitely get the philosophy that you the same kind of things that you would get at Sherman. I don't know if it's more or less because I don't know that. But I know that the people, the resources that we have teaching those classes are really really top notch. I mean, I didn't have him as a teacher for those classes, and I'm kind of sad about that. So he's a wealth of knowledge.
I am going to piggyback on that real fast because I did have Dr. Schultz for my philosophy classes. And one thing I really appreciate and value is it was more of a discussion, which is how philosophy-based classes really should be presented, with all of the history, the information, and really just talking about it, and not trying to guide what your philosophy will be, presenting all of the information to allow you to come to terms with whatever your philosophy is around chiropractic.
That is an excellent point. Thank you, Dr. Pelly. The next question we have is, what adjustment techniques are taught at UWS, and what are the options or electives available to students?
So I will attempt to answer this question, but just like Dr. Novak said, I don't teach in the technique and adjustment classes. I'm not in the classroom. I'm specifically in the clinic. So when I get to work with the students, you've had all of your adjusting technique classes. So we do teach a manual diversified technique. So we like to, again, touch a little bit on many different techniques to give you the tools to create essentially what technique resonates best with you, and be able to pick and choose things that work best for you and maybe don't work good for your body type, or is not something that aligns directly with your treatment style or your philosophy.
That's a really good point. I've heard some of smaller women mention that drop table works better for them than other adjustment technique types just because of their body size. So that makes a lot of sense. Let's see, our next question is, can you speak more on the VA clinic opportunities? Is it competitive?
The VA clinic opportunities are definitely very competitive. The VA is starting to offer more conservative alternative medicine in general, whether it's massage, chiropractic, acupuncture. And so getting chiropractic in the VA facilities has been huge. As I expressed earlier, we are affiliated directly with 10 different VAs across the US. So that means we put 2 interns at a time for that 11-12 rotation. And it is definitely competitive, especially since the VA really only wants to take individuals who that affiliation is going to turn into a residency, which is going to also turn into a job.
Excellent, thank you. Let's see,
oh, sorry. Natasha, I actually would make a comment about that. My wife works at the VA. She's not a chiropractor, but she's an occupational therapist. And my best friend is a chiropractor at a VA clinic. And they are highly competitive, but such great jobs. I mean, you will never be in a more supportive environment. And it's really the variety of patients that you'll see. It's a lot more diverse than you'd think. It's just a great environment. And so it's really, really such a great feeling knowing that it's just only increasing and growing in popularity, and they're increasing their usage of it. So it's I had to make that comment because it's really fun to watch.
Thank you for the shout out. I've also heard from some other alumni that did the VA rotation that they really liked learning about integrative care, being in that type of setting where they're just learning with how to work with all different types of practitioners all the time. So that is another benefit for sure. Let's see. So our last question, since we're talking about philosophy, is the overall chiropractic curriculum a more philosophical approach to chiropractic or a more science evidence-informed approach?
Go ahead, Dr. Novak.
So yeah, I think it would be fairly easy for me to say that we are more of a science and evidence-based program overall. And I think that's a really good thing, because more and more research is really showing support for what we do and showing effectiveness for what we do. And we can be helpful in that regard too, by doing more research and proving the things that we're doing in the clinic on a daily basis. And so, yeah, so I would say with certainty, our program is more of science, evidence informed, making sure that the treatments that we're providing are the best treatments for the patient and that they're appropriate for the patient. And, also we're faced sometimes with things that we don't really know what it is, or there's rare conditions, there's unusual diagnoses. And so, we have to have a place to go to look things up and figure out how, what is the best approach. So yeah, I don't know if Dr. Pelly, if you'd echo that as well, but that's been my experience.
I would definitely agree that UWS is all about science and evidence-informed practice and trying to always do better and keep up with the current research and be able to apply it to our patients. And it is not only for treatments that we're going to be doing, but to help advocate for patients, to give proper referrals and things like that. And we have several classes, the evidence-informed practice, where you learn how to actually go in and appraise literature and determine if there's any confirmation or publication bias, and being able to actually say, is this a good study and is it reliable, and then apply it back to patient care.
Excellent. That's a really good point, because not all of the research is necessarily appropriate. We have one last question that just came in. So how large are class sizes, for example, in the courses Dr. Novak teaches?
So it depends. We have, my classes, I run them in a couple different ways. Lectures, through COVID have been pre-recorded and done online, and you do them in the comfort of your own home in your jammies or whatever. And so, it's a class size of one, and you have, really easy access to ask questions of me. On campus, class sizes vary depending on when you start the program. If you start in fall, class sizes tend to be around 100 people if you're in a lecture type setting. But our lab classes, our hands-on classes, these tend to be much smaller, where you have much easier access to an instructor. So usually somewhere in the range of 20, maybe 25 students. And there's probably going to be a couple of different instructors in like an adjusting class, walking around the room, answering questions and helping you. So probably 20 to 25 for a typical hands-on or lab setting. In a lecture setting, it'll be the whole group kind of all together, which if it's, it could be 100 or it could be somewhere more around 50 or 60, depending on when you enroll. So I think that's probably pretty typical for most of the, all of the classes, kind of regardless of whether it's an adjusting lecture or a radiology lecture. Yeah.
Okay, thank you so much. So now that we've answered all the attendees' questions, I have one last question for both of you. I'm curious what piece of advice you have for someone entering the chiropractic program. If they're maybe thinking about this coming fall, what should they do to prepare?
I guess I'll field that one first. I think just staying curious and being ready to be perpetual student. Obviously, you're stepping into this program as a student, but I think really always being open-minded and not closed off to things, and really using it as an exploration to figure out what resonates with you, what doesn't resonate with you, and not going in with any biases or preconceived notions. I think actually coming and being curious is the best way for you to approach this program.
I think that's a really great response. And I think it's probably too lazy to just say ditto, but curiosity is one of our core values at UWS, and it's one that I rank very high. I spent 10 years working at a bookstore because I love reading, I love books, I love learning. And so, becoming a chiropractor and then deciding to do more studying in radiology, I think it's a really helpful trait to have, is curiosity and love for learning. And but then also think about, what made you interested in the program in the first place? What is your motivation here? Is it that you want to make a lot of money, which is fine? Do you want to help people? Do you want to, relieve suffering for people? Or do you want to do all of these things at the same time, while, also being able to learn new things on a daily basis? That's kind of my motivation is, I just really like helping people and providing just an outlet for my passion for learning. And so it's getting, put to good use on a daily basis. And it just is really so rewarding that I get to do that. And it's super exciting that chiropractic is one of those jobs that, like, really you can do anything you want with it. You can make your practice look however you want it to look. You can do radiology, you can work with athletes, you can work with pregnant mamas and newborn babies. It's just kind of crazy the amount of diversity that you can include in your office if you want to. That was a long answer, wasn't it?
I wholeheartedly agree with you, though. I think it is such a wide open profession for people who are really interested in providing clinical care, and especially in like an integrated way with other types of practitioners. Since we're done with our questions, it looks like everyone's questions are answered. If you do have additional questions after this session, you're more than welcome to reach out to us at admissions@uws.edu or 1-800-641-5641, either about this presentation or about the university in general. And one of us will be happy to either answer that question for you or get you in contact with one of our presenters if it's something specific to them. And we have 2 more Chiropractic Workshop Week presentations tomorrow that I hope you can all attend. But thank you so much for coming to this presentation today. I hope you all have a wonderful day, and maybe we'll see you on campus one day soon. Take care.